Okay, so I have two articles for you today. The first one is from the Advocate, and it is Veterans Affairs doctors banned from writing gender affirming surgery referrals to private providers for trans vets. Because all all these people just worry about the children. You know, Last I checked, trans vets are not children. But anyway, a new policy implemented by the Trump administration, which further abandons transgender veterans who rely on the Department of Veterans Affairs for medical care they earned through years of military service, raises questions about the Republican Party's targeted cruelty toward groups the GOP disfavors. Really? Raises questions? The Advocate has learned that the VA quietly changed its internal policy to ban its doctors from completing forms and letters of support for gender-affirming surgeries for transgender veterans seeking care at their own expense outside of the government healthcare system. Now, though I do not agree with the VA not providing that care, if that's constitutional and if they can do it, that's one thing. But you're barring people from using their own money to get this care? That makes zero sense to me. I mean, it's one thing to want to ban trans people and try to pretend trans people don't exist in the military, but to claim they don't exist at all, which is what this is trying to do. Doctors at the VA tell the Advocate that the policy is cruel, unethical, and saves no money. Advocacy groups and insiders warn that blocking transgender veterans from accessing medically necessary care is about punishment and bigoted anti-trans ideology. Now, considering what Doge did, I'm not entirely sure that the goal here is to save money, because how much money went to waste with USAID because government purchased stuff and then destroyed it instead of distributing it. So this is not about money. This is simply about the Trump administration deciding what people they feel deserve to live. Let's see. And of course it's about punishment and the bigoted anti-trans ideology, because what else is it about? I mean, first they're telling trans people that they can't serve, and they're telling trans veterans that they want to pretend they didn't serve either. So, what else could it be but punishment and cruelty? The change, finalized in July, amends Veterans Health Administration Directive 1134, blah, 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 parentheses 3, which governs how VA clinicians provide medical statements and fill out VA and non-VA forms. Since 2016, providers have been directed to assist veterans in completing documentations for various purposes, including Social Security disability benefits and private insurance applications. Now, only one category for only one specific group of veterans has been explicitly carved out and forbidden. In accordance with VHA Notice 2025-01, parentheses 1, providers are not permitted to complete non-VA documentation for the purposes of gender alteration surgery, the amended directive reads. Now, there was something else I wanted to mention. I don't know. I thought there was something else. Anyway, the amendment has created a sharp contradiction inside the nation's largest health system. Public publicity, right? Publicly, according to VA medical providers who spoke with the advocate on condition of anonymity out of fear of retaliation, VA officials continue to insist that nothing has changed in the availability of transgender people's health care. Privately, providers describe a steady erosion of services from prosthetics and voice training to now the simple paperwork that allows veterans to access care outside VA walls. Veterans who previously sought care at the VA previously told the advocate that they are looking elsewhere and opting for telehealth appointments to avoid feeling discriminated against inside the government facilities. VA just revised their policy to prohibit completion of forms and letters of support for gender affirming surgeries, one VA doctor told the advocate on Friday. This was still technically allowed up until now. On the one hand, VA continues to push the message that there are no changes to care, and yet there have been several harmful changes, this one being the newest. Because the VA does not perform gender affirming surgeries, transgender veterans have long relied on private hospitals and clinics for those procedures. But outside providers and insurers typically require documentation from a patient's existing physician before approving surgery. Well, that makes sense. The VA provider told the advocate that preventing VA clinicians from filling out those forms effectively cuts off access not only within the VA, but also in the private health system. This isn't a theoretical restriction, the doctor said. It will stop some veterans from getting care altogether. And basically, this is the Trump administration saying die. Because let's face it, this is improving their mental health by assuring that they get the care that they need. And if that's cut off, if they're incapable of getting such care, yeah, we all know what the result is going to be. So, the July amendment was not announced publicly. It was quietly inserted into a directive originally published in 2016 and circulated internally to staff. Initially, VA health providers reported that they were informed informally not to complete the forms before the policy was formally codified. The amendment came just months after the VA formally rescinded a 2018 directive that had governed health care for transgender and intersex veterans. In March, the agency issued a notice complying with a Trump executive order that sharply curtailed access to gender affirming hormone therapy, limiting it only to veterans who are already receiving it through the VA or who have started treatment upon leaving the military. It further affirmed that the VA would not provide any surgical interventions for gender dysphoria. The communication rollout was terrible, the doctor recalled. They were only sharing it with LGBTQ plus veteran care coordinators at first, saying, do not do this. And then the policy came out and it was just buried in the documents. In March, VA Secretary Doug Collins outlined the department's plan to eliminate hormone therapy, prosthetics, and most other gender-affirming medical care for transgender veterans who are not already receiving treatment. Hold it. Prosthetics? You do know that will include cis people, right? Dumbass. He justified the rollback by claiming without evidence that most veterans support ending care for transgender vets, and he contended that the decision was a budget-saving measure that would allow funds to be redirected to paralyzed and severely disabled veterans. Okay, so it's a carve-out. It's just for trans people. cis people can still get the same kind of care that trans people had been wanting and getting, but now trans people can't get that care. Lovely. In a Monday interview with The Advocate, the VA doctor described the new prohibition as both senseless and cruel. There's no rationale that I could point to other than it's just simply an attack on transgender people for the sake of attacking, they said. Why else? Because it's not costing you anything, it's just getting in the way of their care. Well, yeah. The medical professional explained that writing a support letter for surgery takes minimal time. For the endocrinology side, wait, what, a few minutes? You simply write a letter to confirm that this person is under my care and that I support them. Mental health letters may take a bit longer if a full evaluation is conducted, but if a provider is already seeing the veteran in therapy, it doesn't require much extra time to write a simple letter. It's not hard, it's not costly, but now it's prohibited. Asked about VA claims that restrictions are motivated by financial considerations, the provider responded, "Make it make sense. There is no financial reason. There is no medical reason. It's ideology, not medicine." The Advocate contacted VA Press Secretary Peter Kasparowicz for comment on the amendment. Kasparowicz initially said he would provide a response and ask for more time, but did not follow through after being offered additional time to reply before an early afternoon publication deadline. Yeah, it was one of those, I'll get back to you, and there was never any intention of getting back. They just, said it to extricate themselves from the situation. Later Tuesday, Kasparowicz responded by citing earlier remarks from VA Secretary Collins, who defended the rollback in blunt terms. Asked what a transgender veteran should do if they receive primary care at a VA facility but need documents to access care unavailable in the system, Kasparowicz pointed at Collins, saying, "If veterans want to attempt to change their sex, they can do it on their own dime." Which is what they're fucking doing. What the hell? Does nobody know? I'm thought that Doug Collins actually had some idea of what happens in the VA. Apparently, the entire administration is incompetent. Nobody in that administration knows what the fuck they're doing. Pressed on whether VA physicians are barred from completing referrals for any other medical condition, Collins said, VA healthcare providers may complete non-VA medical forms to the extent they are authorized to do so. The press office also rejected allegations that the administration previously cited financial considerations contributing to the restrictions, insisting that's false. VA never said that. The March 17th press release that Kasparowicz referred the Advocate to states, all savings VA achieves by stopping specific medical treatments for gender dysphoria will be redirected to help severely injured VA beneficiaries, such as paralyzed veterans and amputees, regain their independence. The Modern Military Association of America condemned the amendment as a deeply concerning step backward for transgender veterans. In a statement to The Advocate, the group said, for years, VA providers have been a critical bridge helping veterans complete the medical documentation required to access gender-affirming surgery through outside providers and insurers. By abruptly prohibiting VA physicians from completing this paperwork, the VA is creating new barriers to essential, often life-saving care. MMAA added that the change sends a painful message that trans veterans' needs are secondary and that their place in the VA system is conditional. Many of these veterans rely on VA providers for primary care. Stripping away their ability to use that trusted care team for necessary documentation forces them into an impossible situation. either start over with new providers outside the VA or face indefinite delays in accessing life-saving care. The group warned that the policy undermines trust in the VA system at a time when transgender service members and veterans already facing heightened health disparities, higher rates of discrimination, and systemic barriers. Instead of closing those gaps, this decision widens them, MMAA said. Lindsay Church, Executive Director, Minority Veterans of America, was even more direct. Gender-affirming care saves lives. The data shows it time and again. For over a decade, VA providers have written pre-surgical letters, just as doctors do for countless other medical procedures, from organ transplants to spinal cord stimulators, Church told The Advocate. They added, stripping that basic medical function away is not about cost or bureaucracy. It's about punishment. By banning VA providers from writing these letters, the agency is deliberately severing transgender veterans from the care they need, not only inside VA, but anywhere they can. This isn't policy nuance or administrative housekeeping. It is targeted discrimination, a calculated form of medical eugenics that uses denial of care as a weapon to decide which veterans are allowed to survive. And that's not hyperbole. It's amazing to me how many people are so willing to put off being trans as all in your head. It's just a psychiatric issue. Okay, but then when they try to help their mental health by transitioning, which is what will help their mental health, you say that that's wrong. So either you give a damn about someone's mental health or you don't. Even the anti-trans own argument they can't be consistent with. The Trump administration's directive prohibiting VA providers from filling out paperwork transgender veterans need to receive non-VA gender-affirming care is beyond disgraceful. It proves once again this administration's disinterest in delivering for all who serve, said Representative Mark Takano, chair of the Congressional Equality Caucus and ranking member of the House Committee on Veterans Affairs. The administration has remained set on targeting transgender veterans' health care. They have rescinded vital protections and are now attempting to obstruct veterans' autonomy, cutting them off from care they pay for with their own dime. Unlike what Doug Collins claims, which is they should get it on their own dime, which they fucking do. We can't stand by these attacks continue. That's why I'm proud to join Representative Kennedy in introducing the Veterans Healthcare Equality Act today. This measure protects transgender veterans' access to health care, so all veterans can access medically necessary care from the Veterans Health Administration without discrimination. All veterans deserve access to comprehensive health care, regardless of the political whims of Republicans on their anti-woke crusade. And, like it was mentioned, these people need care. They are veterans who need care. That is what the VA is for. It is not just for wounds that were sustained while in the military. The VA takes care of all veterans' needs. That is supposed to be what they do. They don't just care for those needs that arise from military service. The provider described a climate of fear inside VA hospitals where clinicians worry that offering evidence-based care could cost them their jobs. I feel like every day I could lose my job because I'm doing clinically indicated ethical care, they said. What they're asking us to do goes against our clinical guidance and ethical codes. You're forcing us into a position where we have to deny services, which then puts our veterans more at risk. That's counterintuitive to the work we're here to do. And that's the other thing, and that's the main thing. And I've mentioned this on plenty of videos, that if you find trans people icky, fine. Nobody's asking you to not find them icky. However, you cannot, because you find them icky, you cannot say that you know better than experts how to treat trans people, which in this case is not at all. Experts know how to treat each, certain conditions. And it is not up to a non-professional to tell doctors what kind of treatment trans people need. Because just like you don't know when a woman needs a hysterectomy, or when a man or anybody needs cancer treatment, you don't know when someone needs gender affirming care for being trans. It's none of your fucking business. It's between the patient and the doctor. That is it. I read that. Across VA hospitals, clinicians have described a growing underground resistance, helping trans veterans in whispered corridors as leadership cracks down on affirming care. In one dramatic protest, a VA psychologist resigned rather than comply with directives that she said conflicted with her ethical duty to patients. Dozens of VA clinicians also signed a letter accusing leadership of abandoning their commitment to serve the veterans who rely on them. Of course they're going to, because in their warped mind, the only military that they want to acknowledge are Rambos. I swear Pete Hegseth watched way too many Rambo movies, because what the hell? He even gave a speech to all the generals and admirals because, you have to do that because of an ego boost. You couldn't just, do a virtual meeting or send an email. No. Pete Hegseth and Donald Trump wanted to have the attention of all the generals and admirals at once so they could feel powerful. And in it, Hegseth said that he wants the highest male standard in order to get into the military. Basically, just admitting once again that he does not think women belong in the military. He claims that he does and that they just shouldn't be in combat positions, but that just tells anyone who's in the military that Pete Hegseth has no idea how the military works, because it's a rarity that you have combat positions and non-combat positions, because combat positions are basically where the combat is. And a lot of people who might not have initially started in a combat zone might end up in one. Anyway, let's see, where was I? The provider characterized the effect on staff as moral injury. Clinicians who entered the VA to serve veterans now find themselves constrained by directives that contradict their professional ethics. We want to provide good quality patient care, but we're being silenced, the provider said. Even if you're doing the right thing, you could lose your job over what you write in the record. People are afraid. The consequences for veterans are immediate. Without paperwork from their VA physicians, transgender veterans are left unable to access surgeries at private hospitals or get insurance coverage approved. What I fear is that you cause more barriers to care. Suicide rates are going to go up, the provider said. But I don't think this administration responds to let's try it again. I don't think this administration responds to data. They literally do not care if the data doesn't suit their beliefs, they'll disregard it. Actually, that's being very kind to the administration. In this case, it's more of cruelty. They don't think trans people should exist. So they're going to make barriers to having trans people exist. So in their mind, trans people will off themselves, and they're fine with it. That is the goal. They want trans people to die because trans people are icky to them. So they don't want trans people to survive. They added that the policy doesn't just undermine access, it also undermines trust. Why would you trust an organization that is actively seeking to harm you and remove your care while telling you otherwise? The provider asked. It totally destabilizes the trust that's essential in any therapeutic relationship. The directive is the latest in a series of consequential changes that have reshaped transgender healthcare at the VA. In 2021, the Biden administration announced it would begin the rulemaking process to cover gender-affirming surgeries. That process stalled. When President Trump took office for a second time in January, support for trans vets stopped entirely. Since then, providers report services being stripped away, LGBTQ plus care coordinators' roles diminished, and veterans left confused or misled. There are so many things that are gender affirming that we don't think of that way, the provider said. If a cis woman has cancer and has a mastectomy, then she gets reconstructive surgery. Is that not gender affirming? Of course it is. But right now they're targeting transgender veterans. And once you normalize this kind of rollback, it won't stop there. The provider pointed to recent Trump rule changes that strip veterans access to abortion care. That shouldn't surprise me because, the way Trump and Hegseth think, women shouldn't be in the military. They should be at home making babies. The provider connected the trend to a wider ideological campaign. If this care doesn't fit with their political or religious ideology, they don't want it, they said. It's unraveling and getting bigger and bigger. This is going to affect all veterans in ways we can't even quantify yet. For the provider, the stakes are larger than a single directive. I think about that poem, First They Came, and how it fits with this moment. For those who don't know, they're talking about the Holocaust poem. Right now, it's transgender veterans being targeted, but this is going to affect everybody. If you're a veteran receiving care at the VA, this could affect what you have access to down the road as well. We should all care about this. They added, this isn't just about transgender veterans. It's about the VA disregarding science, disregarding ethics, disregarding the humanity of the people it's supposed to serve. And actually, there's an editor's note mentioning that they did update the story because of Peter Kasperowitz finally, deemed it, graced the advocate with his presence, basically. Okay, now, so yeah, this is not good for trans people at all. Now, before I continue, since the Holocaust poem was brought up, for those who are not familiar with the Holocaust poem, let me bring that up. Okay. And this was written by a pastor, by the way. In case, for the people who are screaming that this sort of stuff is somehow anti-religious, which I don't understand why, but okay. First they came for the communists, and I did not speak out because I was not a communist. Then they came for the socialists, and I did not speak out because I was not a socialist. Then they came for the trade unionists, and I did not speak out because I was not a trade unionist. Then they came for the Jews, and I did not speak out because I was not a Jew. Then they came for me, and there was no one left to speak out for me. So, that is that poem. So, yeah, basically that's what's happening. And you could do that with the immigrants as well, because they're coming for the trans people. They want them to die. Heck, they're trying very, very hard to kill off not just illegals, but even people who are here legally. If you dare to be Hispanic, or heaven forbid you can speak Spanish, please, please, Bad Bunny, do the halftime show completely in Spanish. I don't care that I don't speak Spanish. I really want this done. I want Trump's head to fucking explode. That the NFL had gone woke because they actually allow someone who speaks something other than English, which Trump can't even speak properly anyway. But anyway, so that is the end of that article. So let's move on to the Independent. I think it's the Independent. Yes, the Independent. Republican legislator admits sending hundreds of child sex abuse videos between work emails. Are you kidding me? It's always the people you expect. Okay. And trust me, it gets better. A former Republican representative from South Carolina, R.J. May, has admitted in court to sending hundreds of videos depicting child sexual abuse to individuals across the country via social media. Mr. May pleaded guilty on Monday to what prosecutors described as a 5-day child pornography spree in the spring of 2024. Ugh. May, who resigned earlier this year, is accused of using the screen name Joe Biden 69, there's like 3 N's, to exchange 220 different files of toddlers and young children involved in sex acts on the Kick social media network, according to court documents that graphically detailed the videos. I don't know if obviously he hates Biden. That's obvious. But I wonder if he was dumb enough to think people would think that was actually Joe Biden and not him. Because he doesn't sound like the brightest. Bear with me. This is very hard to read. U.S. Attorney Brian Sterling said as he haltingly read a brief description of each video for television reporters outside of court, since cameras aren't allowed in federal courtrooms. May, 38, pleaded guilty to 5 counts of distributing the videos and faces 5 to 20 years in prison on each charge. He will have to register as a sex offender and could be fined up to $250,000 according to his plea agreement. The 5 counts represented the worst videos May shared, Sterling said. The felony convictions means the political consultant and National Rifle Association member cannot vote, hold public office, carry a gun, or serve on a jury for the rest of his life. I'm sure he's probably fine about not getting jury duty. Most people don't like jury duty. May's sentencing is scheduled for January 14th, the second day of the South Carolina's legislature's 2026 session. The evidence against May include logs on his laptop and cell phone use, showing he was uploading and downloading the child sexual abuse videos at the same time he was emailing work files and making phone calls. Oh, you gotta give him credit for multitasking. Ugh. May mostly spent Monday's hour-long hearing answering the judge's questions. At the end, when Judge Cameron McGowan Curry asked May if he had anything else he wanted to say, May answered, "Not at this time, Your Honor." May changed his mind and decided to plead guilty just hours after a Wednesday pretrial hearing in which he acted as his own attorney, because those always end well. During Wednesday's hearing, May made arguments to the judge to throw out the warrant used to search his home, laptop, and mobile devices. She denied May's request just hours after prosecutors filed documents detailing May's plea on Friday. Prosecutors showed May used his phone to upload and download videos through his cell network and home wireless network, and also showed him charts explaining in stark, factual ways what was on each video May is charged with distributing. May also tried to keep out any evidence about whether he used a fake name to travel to Colombia 3 times. Prosecutors said they found videos on his laptop of him allegedly having sex on the trips. A Homeland Security agent testified the women appeared to be underage and were paid. U.S. agents have not been able to locate the women. May admitted to using the fake name Monday in court, but was not asked about the videos. May was in his 3rd term in the South Carolina House and was attacking fellow Republicans to go in a more conservative direction before he resigned. You mean child porn is more conservative? What? Seriously, what conservative direction did you want them to go? We as legislators have an obligation to ensure that our children have no harm done to them. Oh, really? But distributing child sex abuse videos is not doing harm. Okay. May said in January 2024 on the House floor during a debate on transgender care for minors. So trans kids should wallow in misery because their bodies don't comport to the gender they feel that they are, but child abuse videos, that's perfectly fine. I'm sorry, what? After his election in 2020, he helped create the Freedom Caucus. He also helped the campaign of Republicans running against GOP House incumbents. The freedom to distribute child porn? Seriously, what is wrong with people? Why is it the people who claim the moral high ground are the ones who are actually morally bankrupt? Why does this keep happening? Anyway, that is the end of that article. So, yeah. Let me see. I believe that is all I have for this video. And with that, I will see you guys in the next one.